We're back, live in studio with Samuel Azurzer in the business headquarters of Radio Shalom 1650 AM in Montreal with the Money and Business Show. You have questions about your personal finances? You need advice in making sound financial decisions? Samuel and his guests are ready to take your call at 514-738-4100, extension 200. And now, back to the Money and Business Show.
My name is Samuel Azurzer from the Money and Business Show on Radio Shalom, CJRS 1650 AM in Montreal. I know what you guys are going to get into your cars. And today's topic is how chiropractors save the government billions of dollars in lost revenues due to low back pain and absenteeism in the workplace, and what can be done to resolve this major problem. And we're here with Dr. Jason Skolar. How are you?
I'm great, thank you, Sam. How you doing?
Good, good. And by the way, I know I cut you off there with the second question, but let me ask it again. What are some of the causes of low back pain?
Absolutely.
I mean, is it baseball, basketball playing, or just
there
not
are many causes.
Okay.
And just to mention, we're speaking about the significance previously before our first pause, the significance of low back pain and how it's become such a significant public health problem. Just to fire out a statistic, in the United States, there was a study that was published in a very prestigious journal called the Journal of Manipulative and Physiological Therapeutics. And this study stated that in the U.S., back pain treatment accounts for approximately $50 billion, with a B, annually in healthcare costs, making it one of the top 10 most treated conditions in the United States. And this has become, again, a major significant public health problem, because if you can't function properly because you're in pain or living with chronic pain, it not only will impact the quality of your life, but if you're working for a company and your boss expects you to perform at 100% and you don't feel 100%, it's not only you that suffers, the companies also suffer, and basically their bottom line also suffers. So it's very important to be able to find solutions in terms of how we can help people overcome and manage their health-related problems naturally, so that they can not only feel great and regain their health and take charge of their life, but also perform at an optimized level. To answer your question, Sam, in terms of some of the causes of low back pain, there are many. The first and foremost would be trauma. For example, if you slip on ice, or you're shoveling snow, or you're working in the garden, or you lift something heavy and you tear tissue, or you pull tissue, or you injure your discs. So any type of physical trauma or a motor vehicle accident, this can cause significant low back pain. Other causes would be repetitive strain. For example, if your job is to lift boxes and perform repetitive movements all day at work, this also can have a significant impact in terms of the overall health and function of your spine. There are other conditions such as degeneration or degenerative disc disease and degenerative joint disease and osteoarthritis. I see in my office more and more kids today, more and more children who come in with low back pain, in migraines and headaches due to poor posture, which is of a huge concern, because there are more and more children who are starting to suffer from back pain, and this has a significant impact on their ability to function and concentrate and to develop as they should and have an optimal alignment of their spine. Also, sedentary lifestyle factors. People who aren't physically active, people who sit all day in front of a computer. There are genetic factors as well. There was a very important study performed by the Japanese in 1991, and they found that if mom or dad suffers from acute or chronic low back pain, 50% of their kids will also be predisposed to suffering from chronic and acute low back pain as well. And so there are many, many causes. There are many causes. There's work-related stress. There's mental stress. There's postural stress. There's a whole wide variety of different causes of low back pain. So what we do as health and wellness professionals and experts of the spine, we find the specific cause, and in order to heal completely and to rectify the problem, we have to treat the essential cause of the low back pain.
Jason, what is the dollar value here in Canada or North America that is being lost?
Billions of dollars.
Billions, eh?
Billions. Billions and billions of dollars. And it's time that someone speaks out and sounds their voice. And that's why it's a pleasure and an honor for me to be here sharing this information with the world, because something has to be done. Companies need to start listening. The government locally, the problem is they don't read our literature. Medical doctors, I hope medical doctors are listening, because they don't read our literature either. We publish studies in the most prestigious peer-reviewed journals in the world that are basically overseen and edited by MDs, and they don't read our literature, and they need to start reading our literature, because if we work in close association with medical doctors and the government and implement strategies which I've already put into place, we can save the government billions of dollars, and we can help companies generate billions of dollars more by saving in lost revenue.
Well, Jason, we're going to have Mark Adler. He's an MP in Ottawa, and he's going to be listening in. I'm hoping he's listening in right now. Maybe you should ask him a question when he, when he calls. But let me ask you the obvious.
Yes.
So, what is chiropractic, and how does it work, and how does chiropractors treat lower back pain differently from a medical doctor?
Yes. I'm glad you asked me that question, Sam, because that really is the most important question. Before we begin discussing solutions to this major problem, we need to understand what chiropractic is all about, because I can tell you, I've been speaking on the radio for many years. I do public health talks. I treat medical doctors, and there are major misconceptions that exist within the medical's eye and the public's view towards chiropractic. And it's time to start dispelling the myths, and it's time to start educating people as to the truth and what it is that chiropractic represents. So before we begin discussing the different treatment options, it's important to first educate the public on what chiropractic is all about and what we do. So for starters, chiropractors are board-certified healthcare professionals licensed by a professional regulating body called l'Ordre des Chiropraticiens du Québec here, just as medical doctors are licensed by the College of Physicians and Surgeons. Chiropractic is the third largest healthcare profession in the world, next to MDs and dentists, and it is in fact the largest natural healthcare profession in the world. In Canada, there are over 4 million visits to the chiropractor each year, and we are known for getting people well quickly, and there are studies that prove that. And for anyone who's listening, I just want to mention that whoever wants these studies, whoever is interested in following up with me or with you to read these studies, please, it'll be my pleasure to provide you with all this information.
Where can they go for this information? Do you have a website?
They can contact you, and I could forward you all the references.
Okay.
And there are many. Or they can call me, or they can send me an email at drjasonskolar@gmail.com. My number is 514-707-2222.
That's S-K-O-L-A-R.
That's correct.
Okay.
And 514-707-2222. And they can visit my website at drskolarchiro.com.
Okay, so how can chiropractors save the government's billions of dollars in lost wages? How can they do that? I mean, you spoke about, reading literature and doing a little bit more homework, but it seems like the government is not willing to do that. Yeah. Well,
I just wanted to add and just mention that to answer your last question, how do we really treat conditions differently from medical doctors, and what is it that we do? We basically, our strength lies in our ability to accurately detect and diagnose conditions that affect the tissues in the body that are involved in this problematic condition in the first place. So what that means is we put patients through a very rigorous initial consultation, a very rigorous physical exam, and we basically look for the causative agents of their pain. We don't medicate our patients, hoping that their condition will resolve. And I mean, no disrespect to the medical profession whatsoever, but we have a very different approach. We believe and we know that in order to heal completely, we have to treat the cause. We can't just put a Band-Aid on an injury hoping it's going to heal by itself. If you have water leaking into your ceiling at home, you can't just paint your ceiling and hope that the infiltration is going to go away. Or if you have a hole in your wall, you can't just put a poster on top of the hole. We need to fix the cause of the problem and identify the cause and treat the cause in order to significantly overcome this particular problem. So we don't treat symptoms as a whole. We treat the cause of the problem. And we use completely natural methods of healing. No surgery, no drugs, no medication. Chiropractors are experts in the field of manual medicine. They're highly educated healthcare professionals, and we basically study for 4 years, about 5,000 hours of academia, and we study the similar core curriculum as a medical doctor would go through, with the large difference being that our approach is not a pharmacological intervention, but a natural intervention using manual therapy protocols and exercise rehabilitation, nutritional supplementation, and everything that conforms to the world of natural medicine.
So what's the difference? I know I just had an email from someone named Joseph, between a physiotherapist and a chiropractor.
Chiropractors are considered to be experts in the field of manual therapy, and the education is different between a physiotherapist and a chiropractor. Chiropractors have received specialized training in different therapeutic protocols, specifically one called spinal manipulative therapy. And just as someone who suffers from dental pain or pain related to a dental problem, they wouldn't go see their medical doctor for this problem. They would go to the world's leading undisputed dental care experts, that being their dentist. And the dentist is the most competent and proficient at treating dental problems. So based upon our field of expertise, which is not just that of the spine, but also any type of neuromusculoskeletal problem, medical doctors and people who work in close association with medical doctors should work closely with chiropractors. And it's time we need to start putting our boxing gloves down, Sam, and we need to start educating other healthcare professionals and sitting at the board table together, trying to find reasonable solutions how we all can work together.
We just started a trend right now.
In terms of physiotherapy and chiropractic, there's a huge difference in terms of the education. And of course, one is a doctoral program. One involves more training academically. Chiropractors are legally allowed to take x-rays. They are legally allowed to diagnose medical conditions, whereas physiotherapists cannot. But again, physiotherapists, they do great work, especially for post-surgical rehabilitation.
And we just started a trend, by the way. If someone needs to call 514-738-4100, extension 200, we have Dr. Jason Skolar. Is a graduate of the Canadian Memorial Chiropractic College in Toronto. He has extensive knowledge and experience in the healthcare professional. And if you have any back pains, if you need some answers concerning your back pain, please call us. He has a lot of knowledge. Again, 514-738-4100, extension 200. So Jason, just wait a couple of minutes. We'll be right back, okay?
Yes.
Thank you.